Hello, I'm Dr. Tim O'Carrigan. I'm an orthopaedic surgeon at Macquarie University Hospital. I specialise in foot and ankle surgery and limb reconstruction. And I'm going to talk about ankle arthritis today. So what is ankle arthritis? Ankle arthritis is where the cartilage wears out in the ankle joint, and that leads to bone rubbing on bone, and it leads to severe pain. And we know that ankle arthritis at its end stage is a very severe problem for patients. It causes tremendous pain, it causes deformity, it causes stiffness, can cause instability, and it severely affects their quality of life, their ability to do the activities they like to do, to walk, to run, to play sport, even getting around day to day. And it also affects patients' mental health quite severely. It's been shown to affect patients' mental health as bad as end-stage heart failure or cardiac failure and other serious problems. So how common is ankle arthritis? It's actually less common than hip and knee arthritis. It affects about 3% of the population. And it's very surprising, in fact, that it's not more common, because the ankle itself, the cartilage is thinner than hip and knee arthritis. The actual surface area is smaller, but the forces going through the ankle are enormous. With walking, it can be 5 times body weight, and with running and high impact activities can be as much as 13 times body weight. Despite this, ankle arthritis is less common, and part of the reason for that is that the cartilage itself is of higher quality than the hip and knee. It is more resistant to wear. What are the causes of ankle arthritis? About 80% of ankle arthritis is caused by trauma. It's a result of either a single traumatic event like a bad fracture, or it can be accumulated trauma over a period of time, such as accumulated instability, malalignment, where the leg is bent and creates abnormal and uneven forces on the ankle. So over time this can lead to wear and tear problems and arthritis developing. The other less common cause, about 10% of the time, is inflammatory arthritis, like rheumatoid arthritis and many other arthritises. There are smaller causes such as gout, avascular necrosis, and other smaller numbers of causes. So what's the treatment of ankle arthritis? So there's non-operative treatment, which can consist of physiotherapy, simple analgesics, bracing, and then surgical treatment. Surgical treatment involves ankle salvage or ankle fusion or ankle replacement. So when we try to salvage the joint, we're not replacing the joint or fusing it, we're doing surgery around it to correct deformity, restore alignment, and this can be appropriate in patients with earlier stages of arthritis, and that can be very effective in terms of relieving pain and improving function and delaying the need for more definitive treatment later on. The reason that we look at this very carefully as a possibility is because ankle arthritis is a younger person's arthritis in general. On average, people are 10 to 15 years younger when they develop ankle arthritis than they are for hip and knee arthritis. So with the other options, it's ankle fusion or ankle replacement. Now, ankle fusion, most patients with ankle arthritis today will be treated with an ankle fusion, and that's been the more traditional treatment for ankle arthritis, and it is an effective treatment. That is where the two bones are fused together, and that stops movement, but it relieves pain. So ankle fusion is very effective at relieving pain. The problem with ankle fusion is that loss of movement, and the other problem is that over time that can lead to arthritis in other joints, because if the ankle stops moving, something else has to. And so the joints in front of and below the ankle can over time develop arthritis, and that can create further problems and require further surgery. So ankle replacement is emerging as a good alternative to an ankle fusion. Now, ankle replacements have been done for quite a few years in small numbers, but the revision rates have been higher than hip and knee arthritis, and that is changing. and there's a number of reasons for that. To talk about ankle replacement, this is an example of an ankle replacement here. And an ankle replacement is where you are replacing the joint surfaces with metal and plastic components. So this here is the component for the tibia, so that's the shin bone, is called the tibia. The smaller bone on the side here is called the fibula, and the bone here is called the talus, that's the ankle bone. So there's a cap on the talus, there's a plate on the bottom of the tibia, and there's a plastic disc in between, and that's the cartilage, or the equivalent of the cartilage. And these components grow onto the bone, or the bone grows onto them, to give it long-term biological fixation. So that's called uncemented, and we do lots of hips and knee replacements that way as well. And so the great advantage of this is that it relieves pain like an ankle fusion, but it preserves movement. And that is very important in terms of preserving function and getting better outcomes for patients and allowing them to be more active. Now, what's changed for ankle replacements is a combination of the actual implants themselves with new designs and better instrumentation, plus also better planning abilities. And so for a patient that presents with ankle arthritis, the process is, of course, a history and examination, x-rays, and a long discussion with the patient about their diagnosis and what the treatment options are. If the decision is to proceed to an ankle replacement, then we arrange for a special CT scan that goes to a team of engineers in the United States, in fact, and they do a surgical plan, which then, as the surgeon, I review. I can modify that plan if required. Once I approve that plan, then they 3D print some jigs, one for the tibia, one for the talus, that is patient specific. That means that it only fits that patient. It won't fit anybody else in the entire world. And we use that jig in theatre as a link to allow us to reproduce in theatre what our preoperative plan is. Now that jig does not stay in the patient. That jig is just used in theatre. What stays in the patient is the ankle replacement. So in theatre, then the patient has a general anaesthetic. We do ankle blocks around here for pain relief, and ankle replacement in general is not as painful an operation as a knee replacement, for example, and the pain tends to be well tolerated. So we do an incision at the front of the ankle, and we have to be very careful with the nerves around the ankle and the soft tissues. That's very important in terms of healing and avoiding problems. We use the jigs, we make the bone cuts and put the components in and carefully sew the wound up. Now, the important factor for a successful ankle replacement long term is restoration of the alignment and soft tissue balancing. That's not only within the ankle joint, but it's also within the foot and below the ankle joint. So we have to make sure that our hind foot, our heel, is aligned and that our foot is balanced. And so to achieve that, sometimes we have to do other procedures besides the ankle replacement. We make all those decisions pre-operatively and talk to the patient about that beforehand. So that we may involve other procedures, and then at the end of the operation, the patient is in a plaster back slab for a week, and we check the wound at 1 week and 2 weeks, because wound healing is the first goal of ankle replacement. Now the patient is non-weight bearing for 6 weeks, and that's kind of the frustrating period for patients, because you want to get going and try out your new ankle, and then you can start weight bearing at the 6-week mark. You're in a boot, which is a removable brace, and you can come out and start active range of motion, but that's for a total of 3 months. And we watch you very carefully during this process, see you at 1 week, 2 weeks, 6 weeks, and then 12 weeks. And then we see you at 6 months and 12 months, and we see you on a yearly basis after that, because keeping an eye on the patient, taking serial x-rays and monitoring your progress is very, very important in terms of us making sure that things are continuing to go well. So that's quite a process, but ankle replacement is emerging as a preferred alternative to ankle fusion in the treatment of end-stage ankle arthritis. New technology, new techniques are improving our outcomes, and it's an excellent solution to a very difficult problem and creates tremendous pain and discomfort for patients.